You are at the peak of your career, or maybe you are just busy with your studies and academics, or maybe you have not found that right partner, or maybe you're not just ready for the baby, but people are after you. When are you getting married? When are you planning a pregnancy? There's a possibility that now you are starting to worry. You think that probably time is running out. In 2014, egg freezing came into limelight when global corporations like Apple and Facebook revealed that they are offering egg freezing as a benefit to their female employees. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today we will talk everything you wanted to know about egg freezing. So stay till the end of the video. There's a lot of information coming your way. So what is egg freezing? Egg freezing is also known as oocyte cryopreservation. It is a procedure in which the eggs are removed from the ovary. They are frozen and stored for the later use. So later, when you are ready for the pregnancy, the eggs are thawed, they are combined with the sperm in the laboratory, and then the fertilized egg is put in the uterus for the pregnancy. Now this means that after egg freezing, you will definitely need an IVF to become pregnant. There is also a term called as embryo cryopreservation. So in this, after removing the egg, it is fertilized by a sperm in the laboratory, and now the embryo, the fertilized egg, is frozen for the later use. So what is better? So if you are married or sure of your partner, embryo cryopreservation will give a better pregnancy rate. But in case you're not married, then it is better to go in for the egg freezing. Some people also like to go for egg freezing because of some religious or maybe the ethical reasons. When should you go for egg freezing? Number one, in case you want to delay your childbearing for any reason and you might be worried that your ovarian reserve is falling. It could be because of career, it could be academics, or maybe you have not found that right partner as yet. Second, in case, unfortunately, somebody is diagnosed with cancer. Now, treatments like chemotherapy or radiotherapy are toxic to the eggs, and we always recommend egg freezing to be done before starting these treatments. Third, in case you are at the risk of premature ovarian failure. It could be because you have a history of early menopause in your family. Maybe you are heading for an ovarian surgery which might decrease your ovarian reserve, or certain chromosomal abnormalities like Fragile X syndrome or Turner syndrome also increase the risk of early menopause. What are the tests to be done before the egg freezing? Number one, the test for the ovarian reserve. Now this is done by doing a blood test called AMH, which is anti-Mullerian hormone, and an ultrasound on day 2 or day 3 of the period to check for the antral follicle count. Now these are the budding eggs in the ovary. These two tests together let us know the quantity and the quality of eggs which are available to us, and to predict the response of the ovary to the fertility drugs which will be used in the ovarian stimulation for the egg freezing. Secondly, we want to screen the woman for the infectious diseases like HIV, hepatitis B and hepatitis C. So now let's understand how is egg freezing done. Now this has got basically 3 steps. Number one, ovulation induction. Second, retrieval of eggs. And third, freezing of eggs. Now, in ovulation induction, when the period starts, typically on day 2 or day 3 of the cycle, certain drugs which are known as gonadotrophins are given to stimulate the ovary to form multiple eggs. Now these follicles, they typically take about 9 to 12 days to finally mature. You would have to go for regular follicular studies on the ultrasound to see how the follicles or the eggs are responding to these medications. And then finally an injection, which is known as HCG injection, is given to achieve the final maturation of the eggs. Second is the retrieval of the eggs. Now, once on the ultrasound we find that the eggs are mature and ready to be harvested, now the patient is taken to the operation theatre. This is a procedure which is done under anesthesia preferably. An ultrasound probe is put into the vagina to locate the mature follicles. Then a needle is finely guided into the vagina, into the follicles, and the eggs are carefully sucked out. Then the eggs are frozen immediately to sub-zero temperatures, which is minus 196 degree Fahrenheit. Now at this temperature, all biological activity in that living cell is completely halted. These days we have advanced techniques like vitrification or using cryoprotectants for the freezing. Now cryoprotectant is a substance which is used to prevent any freezing damage to the cell. Interestingly, the Arctic or the Antarctic insects and the fish and the amphibians which stay in the Arctic areas, they naturally produce cryoprotectants to prevent freezing damage to their bodies. Post-procedure precautions. So you can take rest for about 2 or 3 days post-procedure. It is normal to have little bit of soreness and little bit of discomfort in the lower abdomen. You should avoid any unprotected sex in the cycle after this procedure. You must report to the doctor immediately in case there is excessive pain, excessive bleeding, any fever, any difficulty in passing urine, or sudden swelling or sudden weight gain immediately after the procedure. So what are the risks of egg freezing? Like any other procedure, egg freezing also might have certain risks. Number 1, risks associated with the use of fertility drugs. There is a condition called ovarian hyperstimulation syndrome, wherein ovaries have an exaggerated response to the use of fertility medicines. The ovaries become swollen, painful, the person may have nausea, vomiting, bloating, breathing difficulty, and in some cases the person might even require admission to the hospital. Second, complications associated with the retrieval of the eggs. So when a needle is put inside the body to retrieve the eggs, sometimes this needle could injure the bowel, bladder, or maybe a blood vessel also. Third, there is a big emotional risk associated with it. We need to understand that all fertility procedures, they have a lot of hope attached to it and probably no guarantee of a success. So make sure that you have a good support system around you. How many eggs will I need to freeze? Now, based on your ovarian reserve, which means your AMH test and your antral follicle count on the ultrasound, and also your desire to have how many number of children do you want in future, your fertility doctor would be able to guide you as to how many cycles would be required to get that required number of eggs. Will my egg reserve deplete further after the egg freezing? Not really. 1 or 2 cycles of ovarian stimulation and egg freezing will not deplete the overall ovarian reserve. It actually rescues the available eggs which might probably would have been lost in a due course of time. What is the best age for the egg freezing? So earlier the better. So at earlier ages, we are assured of the better egg count and the better egg quality. So in case you are suspecting that you might need egg freezing later on, earlier the better it is. Is there a higher risk of miscarriage in pregnancy with the frozen eggs? Not really. Once again, the risk of miscarriage increases with the bad quality of the eggs. So earlier, the better it is. Any risk of birth or chromosomal defects. So the risks of birth or chromosomal defects using cryopreserved eggs is same as that of natural conception. So no increased risk. Any time limit on the storage of the eggs. So the eggs can be stored for as long as you want, provided the freezing conditions have been good and the quality of egg at the time of freezing was good. However, most of the centers recommend or advise the people to use their eggs within 10 years of the storage. What is the cost of egg freezing in our country? The cost of egg freezing could vary anything between 1 to 1.5 lakh rupees. The cost could vary according to the amount of the fertility drugs used for the ovarian stimulation. So egg freezing is family planning at the next level. So certain scientific advancements, however controversial they may sound, but they can be actually very empowering, life-saving and practical for many. So do take your own call, consult with your doctor about the various options, and I hope this video helps you to take those important and right decisions for your family. You can also log on to maitriwoman.com for more information. You can also share your fertility journey by writing a blog post on maitriwoman.com. You can also consult us. And like always, today if you found this information useful, please do not forget to like, share and subscribe to Maitri. Next few weeks we'll be talking about IUI and IVF in detail, so stay tuned and we will see you soon.